Hey guys, this is Dr. Aguilera and Jeanette Smith. We are back. This is our third episode to Blueprint to Wellness and
Wellness and
Success.
success.
Hi. So
Hi,
listen to
everyone.
how are you? How are you, Dr. Ada?
I am blessed. Wonderful to be here today.
Yes, yes. So today the topic is weight loss, and we're going to delve into all the things that are happening in this society, especially in America. Millions and millions of people are on the new weight loss drugs,
I
the
know.
GLP-1s, and so we're
This
going to
is,
talk about that.
yes, this is everybody's trying this. I mean, it's amazing the way there's so many millions and millions of people trying these medications, these weight loss. I'm so
Yeah, and
excited
what
that you're going to be enlightening us with this stuff.
You're welcome. And so it's important because, before these drugs were here, a lot of people were trying to lose weight and they couldn't do it, or they would do it and they would gain the weight back. And so it was like a roller coaster. But we have never been in a time where we actually have something that works. And so we're going to get into that with my
Yeah,
colleague here,
yeah,
Dr.
I'm going to
Ada.
start asking the questions. But before we start, I want to
Yes.
know.
Hmm.
Um, And I guess I'll ask that question as we proceed
Okay.
with the interview. But why a weight loss business?
Okay, so she is talking to you and to me about El Camino. So I developed a weight loss business in Jackson Heights, Queens. And the reason I did it was because of my own personal testimony. I had been 50 pounds overweight. I was having a lot of medical conditions. I was getting short of breath. I had hypertension. And I started to take Wegovy. And Wegovy is one of the new GLP-1 drugs. And after taking the drug, I was able to lose a total of 50 pounds. And so for me, it was a life change. So Wegovy, we'll talk about what it does. Dr. Aguilera will ask me some questions, but I am a true believer that these drugs are necessary right now in society so that we can prevent all these medical conditions like diabetes, hypertension, fatty liver, etc. So let's get into it with
Let's
my
get into
colleague.
it.
Mhm.
Yes, yes, absolutely. So, what would you say are the most commonly prescribed weight loss drugs, and do they really work?
Yeah. So, okay. So I'll name some of them. One of them is called Wegovy, which I mentioned. We have Manjaro, we have Ozempic, and these drugs, Zepbound, these drugs, the way they work is they suppress your appetite and they also make your pancreas sensitive to insulin. The problem why people gain weight is that they eat certain foods and their body can't handle it. And so that the body changes carbohydrates, fat, into, fat deposits in your body, and then you cannot lose the weight. So the main thing that I believe the drug does, it allows the food to stay in your stomach longer so that you are fuller and then you don't want to eat anymore. And so it gives you a satisfaction. And then after that, you start to notice you lose weight from that point on. The other thing I believe from my experience with patients is that patients, once they lose 5 to 10 pounds, they are super motivated to lose more weight. So I find that they start going to the gym, they love how they look, they start weight training, they may even do things that they hadn't done in many years, like maybe swimming, and all those things contribute to their weight loss.
That's amazing. That's
Yeah.
amazing. And
Mhm.
now can you touch upon who qualifies to take these weight loss medications, and are there any specific BMI requirements or health
Yeah.
requirements?
Yes, of course. So you can't just take these drugs to go to the doctor and say, give it to me, even if you want them. So you have to have a BMI of 30 and above and have one weight gain condition. Like, for example, you have to have hypertension, diabetes, maybe fatty liver, heart disease. And these conditions are the reason why you're unable to lose weight, or that it can make it worse for you if you have weight on you. So that's what the FDA is saying right now, that you have to have a BMI of 30 and up and one health condition.
So is that why some insurances cover it. I know you mentioned it to me before earlier that some insurances actually pay for this. So is it
That's
because
right.
it's a health concern, obesity?
That's right. So what they find that insurances pay millions and millions of dollars for people that are obese because obesity brings other diseases. So
Sure.
they have found that the way they can save money is basically allowing you to lose weight. So they save millions of dollars. So it's important. It is also important for society that we are healthier. So yes, they do pay for it. And for example, if you come to me and you want to lose weight and you meet the conditions, I send your medical record to an insurance company, and they will approve it. But a lot of some insurance companies are not all the same. So depending if you have Medicaid, it's a little more difficult. But if you have like insurances, private insurance, I find that they do pay for it more.
Okay, okay. Because I mean, the track record shows that being obese leads to other health
That's
issues.
right. That's right. And if your insurance doesn't pay for it, I do offer compound drugs, which a lot of doctors do. And what that is that they now are able to formulate the drug in a pharmacy that's similar to the brand drug. So, for example, with Govi, they can make semaglutide and they can give you at a cheaper rate. So, for
Mm,
example, you may get 4 injections for $200 versus buying the brand, which may cost you 1,200 for the month. And a lot of companies are getting into this business where you're able to get the drug cheaper, but the drug works the same. It suppresses your appetite. It allows you to lose weight. So, if you can't get the brand, I would definitely recommend the compound drug.
Or the side or the generic, right? That's
That's
what we call
right.
it.
And that's what it is. That's the generic drug.
Hmm. And what are some of the possible side effects or long-term effects of
Right.
being on
So
these
long
medications?
term, which a lot of people are afraid of, and it makes sense, but in the long term, we don't have statistics to show what it will do to you in the next 10 years. But that research will be out soon. The initial side effects that I find with my patients, they may feel a little nauseous. Some of them, when they begin, they're fatigued. I have heard conditions where people have lost their hair.
My
um,
friend, I have a
yeah.
friend who's losing
Hmm.
her hair. She's
Right.
losing weight and her hair.
Right. So what happens is that, a lot of times this drug is working on the hormones in your body. So it's important that before you start the drug, that you make sure that your hormones are intact. Maybe you're seeing an endocrinologist, your thyroid is functioning properly. Because if you have hypothyroidism and you start this drug, it may not be the drug. Maybe it's the medical condition under the drug. So it's important to get a very good checkup before you
Mhm.
start the drug. So for me, I check people's labs, I make sure that they're stable, and then I offer them the drug. The other thing, the worst side effect that I have never seen is that because the drug works on the GI tract, it slows it down. The food stays in your stomach longer. There have been episodes where people, their GI tract slows to the point where it's not working. And that's called gastric paresis. But that is less than 1% of the population.
Rare.
It's very rare. And I would never stop giving the drug because I'm afraid of that side effect. But I have heard of that in the literature.
And what about fatalities? Are there any fatalities
I
linked
have
to these?
not heard one fatality, but like I told you, we have to get all this research together, and then eventually we'll know in the future what it can do. My personal story is I've been on the drug, and it works for me. But like everyone has to individualize it. You need to work with your doctor and figure out if it's made for you because no all drugs are made for everyone, right?
Right,
This
right.
makes sense.
We are all so different. And I just
Different,
want to
yeah.
backtrack a little bit. I know you
Yes.
mentioned that some insurances don't cover it. If someone
Yeah.
wants to pay for it, How much money are we talking pretty much out of
So, for
pocket?
example, 7-glutenide, which is the cheapest compound drug, it's about 200 a month for 4 injections. You give yourself one injection every week. And then the highest I've found is Zepbound, 350 a month. So that's basically it. And then if your doctor is charging you a fee, it could be a little more, but it's pretty reasonable right now, compared to what it used to be.
And how long do people need to stay on the medication? How many months would they have to be paying if they were paying out of
That's
pocket?
right. So for example, what I tell my patients that depending on their weight, I try not to keep them more than a year. Like I said, we don't know what the future
Right.
holds for the drug, and I try to wean them off midline. So in the middle of that year, they start coming off the drug. Like I have a patient now; she's off the drug completely for almost a year. She's doing fine. Um, but I do try to wean them off. So I would say for me personally, I think a year is enough for you to figure out what you're doing wrong in terms of exercise and diet, changing your lifestyle, and then coming off of the drug. It's not meant for the rest of your life.
Sure, sure. And I'm just wondering, what about, have you experienced any side effects personally?
Yeah, so when I first started, I did feel nauseous, and I would say by the third week, it started to taper off. So now when I give myself the injection, I don't feel that at all. But in the beginning, I did. I did feel it.
Hmm.
But I never lost my hair, thank God.
God. We said that at the same time. So, and I think you touched upon this. Do people need to change their diet, their exercise, their lifestyle?
Absolutely, absolutely. Diet is really the most important part of weight loss, because you have to realize once you're off the drug, you're going to go back to your old
Yeah.
habits.
Mhm.
So you have to work on that immediately as soon as you start taking the drug. And my recommendation is high fluids, avoid juices, high protein, low carbohydrates, lots of vegetables. Make sure that your plate has all colors of reds and yellows, all the great things that the earth offers us to stay healthy.
Very healthy.
And if you do that, you're going to be okay. But I'll tell you honestly, there are people that never eat healthy and they still lose weight.
Wow.
So
Imagine
that's,
had they changed their lifestyles,
oh my God.
the
Oh my
results
God.
they would have gotten.
That's right. They would do a lot better. But I definitely tell them that they have to change their lifestyle to, just
The
to be
results.
healthy. Yeah.
And just like you said, this is still in a very early stage. It's a
Ages. That's right.
experimental, even though the FDA approved it to be
Right,
used.
but they don't have
Studies, more
20-year
studies.
studies, 10 years, they don't have enough studies to tell you what's going to happen in the future.
Hmm.
But
Hmm.
I'm confident that it's going to turn out well because once you lose weight, there's so many benefits to, like I said before, having less fatty liver, not being a diabetic, not having hypertension. Like, for example, with me, when I'm overweight, my blood pressure skyrockets. Once I lose 10 or 20 pounds,
Same
I
here.
stabilize. Yeah.
Me
And
too.
then, which is what we want, right?
That's what we want. So you mentioned that high blood pressure, diabetes, all these things
hmm
subside for
hmm
many people. But is it possible that the medication can cause it or worsen it or
Yeah,
some?
that's what a lot of patients think because when the medicine first came out, it was meant for diabetics, right? Ozempic was one of the first meds. The reason why these drugs came into fruition is because they noticed that when they were on Ozempic, people lost weight. And so they formulated another drug very similar so that people can use it for weight loss. You're not going to get diabetes taking this drug. The way you're going to get diabetes is when you don't lose weight and you continue eating poorly. And if you have a genetic disposition, but the drugs will not give you diabetes.
Mm. Okay. And the
Mhm.
side effects, are they reversible? Does everything go back once you stop the medication? In your case, it was 3 weeks in that it
Yeah,
disappeared.
yeah. Most of the yeah, you go back to the way you were
Okay,
most of the time.
good, good. Wonderful. Thank
You're
you,
welcome. You're
PA
welcome.
Smith.
You're
Amazing
welcome.
questions, enlightenment. So,
Yes.
so good. I mean, very informative. And I know millions of people, and there's millions of people that have tried weight loss medications, and this is the latest thing.
Yeah, definitely. So let's see how it goes. I'm excited to see the future.
Let us
And I'm
know. Let us know how
yes,
it works out for
I'll
you.
give you an update. I'll give you an update.
Absolutely.
Definitely.
Thank you.
You're welcome.
Okay, well, that was episode 3. Thank you for joining us, everyone, and we look forward to seeing you in our next episode.
Yeah, thank you guys. Have a great rest of the week and a great evening. Bye bye.
Bye bye.